We welcome now Dr. Atul Gawande of the Harvard Medical School. He's also a member of President-elect Biden's COVID-19 task force. So, Doctor, thank you so much for being with us. Let's talk about the vaccine just for a bit here. How fast is this going out? We now are getting some reports that some states are being told they're not going to get as many doses as they thought they were going to have. Is there a problem with the distribution with the manufacturer?
Well, on the one hand, I would say, look, we just got approval now of the second vaccine with Moderna, so there is supplies on the way. On the other hand, I think that the administration's predictions that the general public will be getting vaccinated in the spring sounds optimistic from everything that I've seen. These kinds of hiccups are going to be happening, whether it's production, delivery, it's a massive undertaking. And I want to be careful that we're not sending out messages that say that it will all be over by late spring. I think it will clearly take some months longer than that, probably into the fall.
If not entirely over, at what point, in terms of percentage of Americans inoculated, do we get to a point where it really is making a substantial difference in the pandemic? Is it 70%? Is it 80%? I've heard different numbers.
Yeah, and there is no precise number. I think the 70 to 80% is in the right ballpark based on what we know right now. In the next couple months, we will get much more data to learn a critical thing we don't know. The vaccine reduces your likelihood of getting seriously ill with COVID, but is it stopping you from getting an asymptomatic infection, which would be still something you could transmit to others? We'll know that probably by March. But until then, we only know you're less likely to get sick if you get the vaccine, which is hugely important. And in that case, if that's all it does, then you got to get to that 70 to 80% in order to drive this out. If it's stopping transmission entirely, that will help as well.
Understanding there's no precision to this, but if there's a bell curve about when you think we might realistically expect to get to that 70, 80%, where would that date be, roughly, in the center of the bell curve?
Well, the biggest drivers right now are going to be two things, and that's going to be production and distribution, as well as the willingness of people to get vaccinated. Assuming production and distribution is, going to take, I think, into the summer, I think we're looking at late summer, early fall to be the more likely timeline that that people can count on. Is it possible it happens faster than that? Absolutely, but that is not what I would bet the farm on.
So you were such a specialist in public health, Doctor. Give us some guidance here about what do we do to get to that point. I mean, we had Andrew Cuomo, the governor of New York, earlier today, say that we now set a new record for one-day increase in cases of 12,000 in New York. And we're seeing this in California. We're seeing it around the country. What do we do in the meantime?
Yeah, I think it's so important to understand that right now the epidemic is worse than it's ever been. As of the last week, COVID-19 is now the #1 killer in the country. We have more deaths per day than from heart disease or any other category of illness. So, and this is getting worse. As we head into the holidays, we're seeing the possibility of what Dr. Fauci called surge upon surge, right? People got together over Thanksgiving. Now we're going to have that happen at Christmas. We already know we're going to cross the 400,000 death point based on the number of infections happening now. Millions of people, 1 in 100 people tested positive in the last 2 weeks, meaning a massive amount of active infection that's still out there. So what do? The critical steps are the ones we've known from the very beginning. It's taking seriously, wearing our masks, maintaining social distancing, being restrictive about those we get together with outside of our household. And when we do get together with others outside the household, absolutely maintaining that distancing. And when we can, get testing to be sure that that we're not getting infected ourselves. It really is those basics. And our behavior drives it down. Now, the big issues are indoor gatherings, especially where people are eating and drinking and therefore taking off their masks. It's a small percentage of the population that's driving much of the behavior, around 20%, who are not wearing masks, getting together with larger groups of people, but they are keeping this infection going. And we got to get to where we're 90% doing the right thing and better.
Dr. Gawande, as you've pointed out, we have a ways to go, and we have a lot of work to do to get to that point. You are a member of President-elect Biden's COVID-19 task force. Beyond the COVID-19 issue, give us a sense of what this pandemic might do to our healthcare system that could be positive. Are there things that we're learning about our healthcare system, about what we can do from this pandemic that maybe we would not have learned, or at least not have learned as quickly?
Well, I'll give you two dramatic changes. People have talked about the transformation of healthcare to be much more virtual, be accessing telemedicine. Most of your viewers at this point have had a medical interaction now that's through this medium or via the phone, and it's proving to be highly successful, convenient, and enables people to get very good care. There are certainly lots of situations where you got to be face-to-face with the patient to get to understand what's going on. But then the next step that's happened just before Thanksgiving, the Medicare approved being able to even provide hospital care in the home. That is acute care for whether it's illnesses like congestive heart failure, pneumonia, and others. My own hospital, the Brigham and Women's Hospital, we have been deploying hospital at home care where you take people from the emergency room who would have been admitted and we send them home. And we have found that it is not only safe, the patients do better. They have less likelihood of bouncing back into the emergency room. They're walking 300 steps a day instead of only 30 steps a day while they're in the hospital. They are also, the care is costing 20% less, and savings can be even larger than that. So that transformation to moving hospital care into the home is a big deal. And then we're already seeing with the approval of at-home testing for COVID, and that trend is going to continue where diagnostic testing will become something relatively rapidly that is going to become widely more available at home, not just for this virus, but for many other viruses and bacterial infections and other conditions. So that's a silver lining here, that we're learning how to finally move out of all of the giant places that you have to travel to for 15-minute visits and understand that it's deploying the right care in the right place at the right time for people where it works best.